Hi everyone, good morning. I'm on my way to meet with Maya Health Alliance, which is an organization we partner with. I'm headed first to their headquarters, which is in Tecpan, about an hour and a half outside of Antigua, and then go into a couple different communities where Maya Health Alliance is working. We're going to meet with various community members who are receiving family planning services from this organization and do follow-up visits and checkups just to make sure everything's going well. Maya Health Alliance works exclusively with Mayan communities, which are disproportionately affected by lack of access to healthcare services. In terms of reproductive healthcare, the disparities are even worse. So Maya Health Alliance does a great job facilitating better health. They offer services entirely in Mayan languages, which is a way for Mayan communities to still receive healthcare. In many instances throughout Guatemala, the only healthcare that is offered is in Spanish. So they, as an organization, have community healthcare workers that go out and, again, in the language that the community speaks, are able to provide care and services in reproductive health, family planning services, maternal and infant care, child health, and so much more. They work with over 11,000 community members each year. So follow along with me as I go into these communities and we meet with these different community members. The first community we are visiting is just north of Tecpan. It's a Mayan community called Huachichel, and we're going to be visiting one community member there who has recently received an IUD, which is a long-acting contraceptive method. So we're going in just to make sure everything is going well. This is a community member who has 3 children. She's 22 years old. She first started having children at age 17. So this IUD has been really influential and important for her in being able to control her family size.
It's hard to have more kids and to provide them with the resources they need. That's why it's important.
She likes it as a method of contraception because it is something that lasts a long time. It doesn't require too many follow-ups. This is important because she lives in a rural village where it's kind of difficult to go into a healthcare facility. And in fact, Maya Health Alliance is going out to her to provide this service. Her husband has recently passed away, unfortunately, and she is now the primary provider for her family. As a profession, she sells fruit on the side of the road and then also receives remittances from her brother who works in the United States. So again, having access to family planning services and being able to access this type of care in her native language as a Mayan community member has been super transformational for her and for the community overall.